March is Endometriosis Awareness Month, a time to shed light on a condition that affects millions of women. We have OBGYN Dr. Antonia Traina joining us to discuss the signs to watch for, available treatments, and how to better support those who are living with endometriosis. Good morning, doctor.
Good morning. Thank you.
Tell me first, for those who don't know, what is endometriosis? What are people up against?
Yeah, so endometriosis is a condition where the inside of the uterus kind of grows on the outside. And so it can grow anywhere. It can be on the bowel, the bladder, nerves, muscles. And so it really can affect people's periods, but also just their general quality of life.
So, does it make it more painful for your period? How does it affect you?
Yeah, absolutely. So, I tell a lot of people it's normal to have painful cycles, painful periods, but it's when those periods really are affecting your quality of life, not being able to go to work, not being able to go to school, missing days. Those things are red flags, and that is something that would make me concerned that endometriosis may be present.
So what is the process if you think you may have endometriosis? I had friends who used to have to miss school back in high school or miss soccer practice and things like that. They may not have known they had it at the time. Is there a certain age where it's usually diagnosed?
So I wouldn't say there's a certain age it's diagnosed. It can happen in any reproductive age female, so it can happen as early as adolescence. So when you start your periods, you may start to have those symptoms. It'll typically go longer without getting diagnosed because we're so used to painful periods. But it's really important for those children that are missing school that they, see a gynecologist, talk to a gynecologist, so that earlier diagnosis leads to better outcomes.
Once you are diagnosed, what does that process look like? How do you go about getting treatment or getting better?
Yeah, absolutely. So a lot of gynecologists around the city do handle endometriosis, but there are those that specialize in it, and it can be some things where, depending on what the goals of care are, so whether it's pain control, if someone's later in life and looking for fertility things, so kind of depending on their goals of care will depend on how they get treatment. So it can range from medicine to surgical management, and ultimately, again, just kind of going for their goals, the patient's goals of care.
I've had friends who didn't know they had endometriosis until they came up against infertility. Is that when a lot of women find out that they have this?
Yeah, absolutely. So I think one of the biggest things is when patients come to fertility or come with complaints of infertility, about 30% of women that come with infertility will have some sort of endometriosis. And so that's one of the signs, but if you're recognizing earlier that you're having those really painful periods that are missing school and work, we can diagnose you earlier and maybe prevent some of those fertility issues.
Wow. So this is something that once you start taking care of it, it can really turn things around and change things for you. So if you are having really painful periods, it's important to talk to your OBGYN about that.
Yes, absolutely. That would be the kind of one thing I would love people to know from endometriosis is that painful periods, those that are keeping you from work, from school, would be the time that I would say talk to your gynecologist, because it may be that, and we can diagnose and treat and get things under control.
And if it's not, y'all can help us with that too.
Absolutely, absolutely.
Thank you so much, doctor. I appreciate a lot of good information.
Yeah, absolutely.